Hi, I'm Dr. Heather Pendle with Full Potential HRT Clinic. This video is for patients on testosterone replacement therapy. It's a demonstration video to explain all of the supplies that you got and how to use them, and a little bit of advice on how to do the injections. So first of all, the two needle syringe combos that you got are the 27 gauge and the 31 gauge needles. The 27 gauge are for testosterone. They're a little bit bigger because testosterone is a thick molecule, so it takes a little bit more to get that thick oil through the needle and into the syringe and also into the muscle. The 31 gauge is for the HCG. HCG is water-based, so it more easily travels through that really, really small needle and is a little bit easier to inject. These needles, I'll show you here. This is the 27 gauge here. And the most common dose is 45 units. So there's 40 and there's 45. There's 50 and there's 45. It depends on your individual dose and what your doctor advised you to inject, but just for the units on the syringe, there's 40 and 45. You follow the line on the black plunger, so you fill it right up to where that line is, right there. And then for the HCG, again, the most common dose on this one is 25. This syringe is smaller, so you'll see the entire syringe only goes to 30. The most common dose is 25, but just read your instructions and follow your doctor's advice for your individual dose. The most common is 25. This entire syringe is 30. When you are done with your injections at the end, you will use this needle clipper. So what you do is you just squeeze the sides and it pops that up right there. Squeeze and it pops up. And then after you're done injecting, so you've injected into the abdomen with the HCG, you stick the needle into the clipper and then you clip down here and it cuts off that needle. Same with the testosterone, stick it in there, clip it, goes back. And then you can do that and it goes flat again. You push these to put it up. This needle clipper is only for the injection needle syringes. There's another needle that you got in your supplies. It's this bigger needle and it also came with a bigger syringe. This is for mixing the HCG. So what you do is you take the needle, screw it onto the syringe, and you will use this to draw up water to mix into the HCG powder to reconstitute it. The HCG comes as a powder and a water because it's more stable this way. You can keep it on the shelf for a long time when it's in a dried powder form. Once you mix the water in, it's important to keep this in the refrigerator so it stays potent. It's really vulnerable to light and heat that can decrease the potency if you leave it out room temperature or in light. So you'll mix these. What you'll do is you'll get this mixing syringe. Pay attention to your instructions again. The most common dilution is 3 mils. So you'll stick this in here. Upside down is the easiest, so it's in here. Draw back to 3 mils of water. Then you have 3 mils of water and inject it slowly into the HCG. You can hold on, sometimes the pressure wants to draw that water in, so you can hold on to the sides of the plunger here and just let that, or hold your finger here so that you're kind of stabilizing that plunger and let it go in. And once the water's in, mix it, stir it, don't shake it. Stirred, not shaken, because these molecules are vulnerable. We want to keep them active and the most potent. Okay, and then there's a pill cutter. The pill cutter here is for your anastrozole. You cut it to your individual dose, so based on your instructions, maybe you're a half a tab, you just cut the pills in half on the hashtag. Maybe you're a quarter of a tab, you cut a half in a half. And it just makes it a little more accurate and easier to cut that to your individual dose. And then, when you're done with the mixing needle, so when you're done with mixing this HCG, you take this needle off and you stick it into this sharps container that was given to you. So a sharps container, stick it in there, and this will take a long time to fill up because you're only using about 1 mixing needle per month. Unless you're doing other, peptides or other medications. With HCG, it's about 1 mixing needle per month. So it'll take a long time to fill this up. This can go in the garbage. And then for the injections, some quick tips on how to do those with as little pain as possible. So you'll have your testosterone needle syringe here. Before you're ready to inject, always make sure you clean the vial with alcohol, and then just do a quick check, look through light, make sure that the oil is clear, there's no cloudiness or anything floating in there, because that could indicate contamination. So you've cleaned the top. You can, some people like to draw back the plunger to their dose to inject air into the vial, and that might help it a little bit easier get the oil in there. And then you can hold it like this if you want to, have the needle in there, and then slowly draw back to your dose. It can take a little while because these are small needles and this is a thick oil, so just have some patience, let it fill up to the right level, and then sit in a comfortable spot with your elbow rested on the table and roll up your sleeve or take your shirt off and find the deltoid. So the deltoid comes down to a point right here. You can use your hand with a V and say, okay, right there's the deltoid. The belly is like that big space right there. Don't go too far forward, too far up, or too far back. We want to be right in that belly. And then wipe the area with the alcohol swab. Have your needle and try to inject at a 90-degree angle. So I like to stabilize my wrist for injections. Just makes it easier, then you're not like free floating, you're stable like this. And then try to be at a 90-degree angle, because then you'll bypass most of the nerves in there. If the needle is right at 90 degrees, it just goes right through there. Then you won't really feel any like pinching or stinging. So right through there into the belly, make sure there's a little bit of an indent and that the needle is buried to the hub. The hub is about right there. So once you're in there, you can pull back just a little bit to aspirate. That's just to make sure that you're not in a major blood vessel, because we don't want testosterone in the bloodstream. We want it in the muscle for a slow absorption. And then just slowly inject the testosterone. And the slower, if it burns or stings at all, just slow it down and push it in even slower. And then just come right back out the way you came in. And if there's any bleeding or soreness, just get a cotton ball or the alcohol swab and put some pressure on there for about 15 to 20 seconds. For the HCG, the smaller one, it's really easy because it's in the abdomen, and it's such a small needle, but same thing, alcohol swab, wipe off your vial, wipe off the area on the abdomen. Just beside the umbilicus is the ideal location. This needle will only go into the subcutaneous tissue just below the skin. So you don't have to aspirate with this one. You don't have to pull the plunger back. You just do a quick poke and then inject the liquid, the HCG, into the abdomen. All right, that's about it. Call the clinic or message your doctor if you have any questions, and thank you. Okay, so we're going to do a quick demonstration on how to do the testosterone injection into the deltoid. So first, have a seat in a comfortable position with your arm rested on the table. Next, find the location of where you're going to inject. So locate the bone at the top of the shoulder there, and then at the bottom of the muscle belly, you'll locate it, and then right in between there is the belly of the deltoid muscle, which is right where you want to inject. Then you'll take your alcohol swab, clean the area, and get your testosterone injection ready, and angle it at 90 degrees from the skin. Do a quick poke, and then aspirate. So you pull back the plunger just a small amount to make sure that you're not in a blood vessel, and then start the injection slowly. If you feel any pinching or burning, pause for a second or slow the injection down to allow the muscle to relax and the oil to dissipate into the muscle. It's okay to inject slowly over a 5-minute period if that's what it takes to get the oil to slowly get into the muscle without pain. And then once the injection is complete, pull the syringe and needle out the same way that you injected it, and you can apply pressure or rub the area for a few minutes if there's any pain, and if there's any bleeding, you can also put pressure on that for a few minutes. Okay, so now we're going to do a quick demonstration on how to mix your HCG vial. You'll have your vial of powder and then the vial of bacteriostatic water. Always follow the instructions on your box and mix however many mils you're instructed to mix of water into the vial. So first thing you'll do is open the alcohol swab and wipe off the tops of the vials. Then you'll get your mixing needle and syringe, connect them together. These are the bigger syringes and needles that were in your package specifically for mixing the water into the HCG. You'll draw back the plunger to 3 mils, which is typically how much water you're going to mix into the HCG powder. Inject that air into the water, which will help the pressure, and then the water will easily slide into the syringe. Next, insert the needle into the HCG vial and let the water slowly go into the powder. Once the water is in there, never shake the vial, always roll it around, stir it, let those molecules gently reconstitute into the water. Perfect. And then for your injection of the HCG, this is going to be subcutaneous, so always re-clean the vial after you have used it, and you'll get your 31 gauge needle and draw back the plunger to whatever your dose is. Usually it's 0.25 mils, and then inject the air into the vial, and then pull back on the plunger and let that HCG fill the syringe. If there's any air bubbles, you can pull it back farther than your dose and then push the fluid and air back into the vial and then pull back again until you get your correct dose with just HCG. This is a really small needle, so it can take some time to get the HCG into the syringe, which is why we're pulling back farther on the syringe right now to get that HCG to move more quickly into the syringe. All right, and then to do the injection, we're gonna do this in the abdomen. So first, clean the area with an alcohol swab. And then inject 90 degrees just to the side of the umbilicus. Quick poke. And then you can inject the HCG a little more quickly than the testosterone, and it should be fairly painless.